Assalamu alaikum and welcome into the 12th match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into the 12th match of Cardiometabolic Premier League, that is between HMC rivals versus DGK Seekers. We are into the 12th match and it is going to be a deciding one because it will decide who is going to be qualified for Super 6 stage from Group D. We have already 3 teams from Group A, B and C qualified for Super 6 stage. Today, we are blessed with the kind presence of Professor 𝐏𝐚𝐤𝐬𝐬𝐿 sahab. He would be serving as an umpire of today's match. He is Professor of Medicine and Senior Vice President of PSIM. Along with him, we have, he will join us shortly, Professor Mohammad Ishaq sahab. He is Patron-in-Chief of Cardiometabolic Premier League. And for moderation purpose, we have Assistant Professor of Cardiology, Dr. 𝐏𝐚𝐤𝐬𝐬𝐿 sahab. He is Assistant Professor of Cardiology at RIC Rawalpindi and Stroke Interventionist. For further moderation, over to Dr. 𝐏𝐚𝐤𝐬𝐬𝐿 sahab.
Thank you very much, Usman. So it's great to be back again, like always. And I'd like to take this opportunity to welcome you all to this amazing and outstanding first season of Cardiometabolic Premier League, which is brought to you by Wilson's Pharmaceutical and Pakistan Society of Internal Medicine. Now, we know that we are getting closer to that stage where things are becoming clear in all the leagues, in all the groups. It was always a knockout for everyone. But I think the fight and the competition has lived up to the expectation. Today, we again have a wonderful competition ahead of us. We have DGK Seekers versus HMC rivals. And I am hoping that it's going to be a great fight and we will see a wonderful match once again. We are nearing the Eid, so the excitement is high, yes, but I think today the excitement is even higher because the two teams are going to fight in this extremely meaningful match. I would also like to take this opportunity to welcome our esteemed faculty, our council members. So our Patron-in-Chief, he'll be joining us soon, Professor Ishaq sahab. We have our umpire who's always there to guide us through, and it's none other than Professor 𝐴𝐻𝐸𝐻𝐿 sahab. Welcome, sir. Along with that, we'll have other panelists, other council members joining us, but we do have the mentor of HMC rivals, Associate Professor Dr. Tariq Meher. We have the coach of HMC rivals, Dr. Asif, and from DGK Seekers, we have their coach, Dr. Mohammad Amir Iqbal sahab. So I welcome you all to this great game, and I know the hopes are pretty high, but so are the stakes. With this, I'm going to turn towards the two teams, and we all know that I always randomly select one of the teams, and the two team captains are going to give the introductions of their respective teams. So we are going to start with DGK Seekers. Can we have them on screen, please? Yes. Captain, introductions, please.
Assalamu alaikum. I am Dr. Kamran from Allama Iqbal Teaching Hospital, DG Khan. And we have here in the team Dr. Kaisar, Dr. Sajjad, Dr. Ikram, and our team coach is Dr. Amir, and we have a mentor, Dr. Sir Haloon Bilal sahab.
Right. So, yes, it's great to have them all. So, are you geared up for the match? Hopes are high?
Yes.
All right. So, best of luck to you. I now move to the other team, that is HMC rivals. Rivals, are you ready? Introductions, please.
Yes. Assalamu alaikum. My name is Dr. Bilal. I am from the Department of Medicine. We have Dr. Junaid, Dr. Usama, and Dr. Hassan. And we have, that's all.
Okay, so that's wonderful to have you in this game today. And, you seem to be geared up, and best of luck to you as well. So with this, I'm going to move towards the start of the game, and as always, the weather conditions. So I think it's been raining here a bit, but I do see a wonderful pitch, and I'm hoping that the scores are going to be high. All right. So I think we are ready with the toss. So we are going to have an electronic toss. All right, we have it on the screen, and I'm going to randomly ask one of the teams whether they want heads or tails. So on my screen, I have the rivals. What do you want, heads or tails?
Tails.
Tails. All right, roll the coin. And it's a heads. Okay, so DGK Seekers have won the toss. That's the first hurdle and they've crossed it. I think the luck seems to be on their side. So can we have them on the screen, please? DGK Seekers. I'm going to pose you with two questions as per the format of the game. The first question is whether you want to throw the questions or you want to take the questions.
We want to take the question.
All right, so they've decided to take the questions. And the second question now. You have two scenarios in front of you, A and B. So you have to select one of these.
A.
And they have selected A.
Yes, A.
Case A. All right, so the news from the center is DGK Seekers have won the toss. They want to take the questions and they have selected the scenario, the case A. All right. So, both the teams are ready. Sir, should we start the game, sir? Professor Aziz Saab.
Yes, please do.
All right. Let the games begin. Can we have the case scenario on the screen, please? I'll request the team to start reading the Vignette, the question. The Vignette scenario should be read by HMC rivals. Please read the scenario.
We can't read it, just zoom
Okay,
it
technical
a
team,
little bit.
can we have this sorted out? They can't read it. Can you read it now?
The quality is poor and we cannot see properly the scenario.
Okay, so
can you
technical
please
team.
zoom it out?
Yes, technical team, do the needful, please. I think the team on ground has to help them. And I think
It's
you'll
clear
get a
now.
screenshot soon.
Can I start it?
Yes, please.
A 65-year-old female presents with dizziness, particularly on standing. She has had diabetes for 30 years. Her blood pressure shows a postural drop of more than 20 mm of Hg. Her husband, who had diabetes for 40 years and similar complaints, died suddenly. She is concerned about potential cardiac complications. She is accompanied by her granddaughter, a medical student who also asks questions.
Okay, DGK Seekers, I'll give you a couple of seconds to gather yourselves and then let us know when you're ready. Seekers, are you ready?
Okay. Yes, we are ready.
All right, so bring the first question on. Read the question, please, rivals, along with the options.
Which of the following arrhythmias is most commonly associated with diabetic autonomic neuropathy? Atrial fibrillation, sinus tachycardia, bradyarrhythmias, ventricular fibrillation, atrial flutter.
You have 60 seconds on your screen. It seems to be a good length delivery. Let's see how they play it. All right, so the answering team, please keep your mics on. Everyone else to keep them muted. Answering team, please, we want to hear your discussion. 20 seconds left. Unmute yourself.
Okay. Okay. Beta B.
Beta B.
Sinus tachycardia.
Sinus tachycardia. So are you sure? You want me to lock it?
Yes.
All right, they are sure. They're going for the big hit. Lock B beta. Oh, and they've missed it. Took the outside edge and into the slips. Goodness me. All right. So the first question has been missed. Never mind, you still have 9 questions. And be smart, be sensible, and be careful. Question number 2 on your screen. Read it, please.
What is the underlying mechanism of arrhythmias in diabetic patients with autonomic neuropathy? Hyperkalemia, QT interval shortening, vagal denervation and sympathetic dominance, increased catecholamine breakdown, or the screen is not clear. I cannot see.
E
the
is
option E.
hyponatremia, and 60 seconds on your screen, please. The answering team, unmute yourself. We want to hear you discussing it. And technical team, please sort out the screen issues. Answering team, seekers, please unmute.
मेरा ख्याल है डी करना चाहिए सी और डी क्योंकि बाकी सारे जितने हैं वो टेक्निकल डी इंक्रीज कैटाकोलामिन डेटा
25 seconds.
कैटाकोलामिन से मेरा ख्याल है डी का क्या कहते हैं
15 seconds to go. Hurry up.
D.
D delta.
Delta.
Are you sure about it?
Yes.
Another stroke towards the offside. Let's see. So lock D delta. Oh no! Another one has been missed. Goodness me, again, you see, it's brilliant bowling. I think the pitch seems to be a bit tough. All right. 2 questions. Both have been missed so far. Come on. Right. Bring question number 3 on the screen, please. Read the question.
The patient was advised to undergo an ECG, which revealed a prolonged QT interval. A prolonged QT interval in a diabetic patient suggests increased risk of myocardial infarction, risk of Torsades de Pointes and sudden death, autonomic overactivity, hypoglycemia, hypomagnesemia.
And the timer starts now.
कर दें बेटा
Beta.
Okay, so are you sure about it? This time you seem to be pretty confident. Down the wicket.
Yes.
B.
Hopefully.
You want me to lock B beta. Okay, so they've come down the wicket. They're going for a 6 at long off. Let's see what happens. Lock B beta. And yes, that's brilliant. So it's not a hat trick of misses. You've come up with the right stroke, right answer, and very well done indeed. So we're on the board. Well done, seekers. Question number 4, on your way.
Her granddaughter is curious about the test commonly used to evaluate cardiac autonomic function in diabetic patients. Which of the following tests is used for this purpose? Holter monitoring, Valsalva maneuver, tilt table test, heart rate variability to deep breathing, Ewing's test.
And your 60 seconds are on the screen. So this one is an in-swinger. Let's see how they negotiate. Please keep your mics unmuted. We want to hear your discussion. Seekers. Unmute.
चलें एक बार मैंने अपनी की है इस बार क्योंकि हॉल्टर मॉनिटरिंग ना 24 आवर ईसीजी मॉनिटरिंग है तो आपको 24 घंटे की
25 seconds.
अच्छा चलो
डी कह देते हैं।
देखें जैसे आप मेरा ख्याल होल्टर करें ठीक है
15 seconds.
D, delta.
Are you sure about it, Captain?
Of course.
The discussion was interesting and we want to hear your discussion. We really enjoy that. So keep the mic unmuted. All right, so we are going to lock D delta. Let's see. And yes, you see, discussion matters. The team matters and you have done very well. You've played it the right way and definitely a 6. Beautifully played, beautifully answered. Keep it up. So we are definitely on the board. We're in the game and we are doing the goods. Okay, question number 5 on your screen. So I think the HMC team is not there. There is some technical issue. So I'm going to read the question. Question 5. She is diagnosed with autonomic neuropathy. One of the earliest ECG findings in diabetes-related autonomic neuropathy is option A, ST elevation. Option B, short PR interval. Option C, reduced heart rate variability. Option D, delta wave. Option E is U wave. Just hold on, I think we'll not start the timer. Can they hear me?
साथ कम ज्यादा
Okay, so let's start the timer.
ठीक होता है तब होती है जब वो ऑटोनोमिक न्यूरोपैथी हो जाती है ना फिर वो वेरिएबिलिटी खत्म हो जाती है तो इसका सी होगा रिड्यूस
क्योंकि हार्ट रेट है ऑटोनोमस सिस्टम है
वेरिएबिलिटी खत्म हो गई उसकी
बस
ब्रीथिंग
इलाज
के साथ
करते हैं बाकी देखा जल्दी करें गो अहेड
सी करें
C.
4
You want me to lock C?
Yes.
C is Charlie, reduced heart rate variability. Is that so?
Yes.
So I could hear Jaldi Kare. Somebody is, I think we've got a Jaisuriya there somewhere. So they really want to hurry up. All right, let's see what happens. Can we lock C? And yes, the Jaisuriya in your team was right. You came down the wicket, played that over cover, and that's wonderful. Hat-trick of 6s. Very well done. Professor Ishaq Saab, whenever you try to jump out of your crease, give the answer in a hurry, he's always wary because he's always telling all the teams to take your time. But if you're sure, why not? All right. So let's bring question number 6 onto the screen, please. Do we have HMC there? So they are not yet there. I'm going to read it myself. So question 6 is, which diabetic complication increases the risk of silent myocardial ischemia leading to arrhythmias? A, retinopathy. B, autonomic neuropathy. C, nephropathy. D, gastroparesis. E, microangiopathy. And the timer starts now. And I'll request the teams not to start discussing it until we have completed the question. 60 seconds are on your screen, please.
बी है बेटा
डन
Should we lock?
लॉक
Okay. Beta.
So Jaisuriya is out again. He wants me to lock B beta. Is that so?
Yes.
Okay, so I'm going to lock B beta. Lock it. Yes! Well done. Jaisuriya is in a hurry at the moment. I think I do also see a bit of a 𝐏𝐚𝐤𝐢𝐬 Ayub there. Well done, well played. So this one I think is a scoop over fine leg for a 6 and 4 6s in a row. So that's good going. Very well done. Very well done indeed. And with this we are now moving to question number 7. And I think I'll have to read this one as well. And the question 7 is, what is the primary mechanism for increased sudden cardiac death in diabetics? A, increased blood pressure. B, atherosclerosis and autonomic dysfunction. C, hyperinsulinemia. D, coronary vasospasm. E, insulin resistance. 60 seconds on your screen.
तो the autonomous
Hyperinsulinemia.
ऑटोनोमिक डिसफंक्शन से एरिथमियाज होते हैं एरिथमिया सडन डेथ की कॉज है एथेरोस्क्लेरोसिस एमआई की कॉज है। एमआई भी सडन डेथ करता है। बीटा ही है ना, बीटा
प्राइमरी
ही होगा।
मैकेनिज्म
बीटा
और
हाइपर इंसुलिन ग्लूकोज बार लो होती है और वेट गेन होता है उसमें।
हाइपर इंसुलिनीमिया में
हाँ,
ना वो तो एक
बी है, बी कंफर्म
बी है। एथेरोस्क्लेरोसिस एंड ऑटोनोमिक
डी
सडन कार्डियक डेथ ऑटोनोमिक डिसफंक्शन
बीटा बीटा
So we have 22 seconds. Are you sure? Which option?
yes बीटा
Beta, B. So they are going with atherosclerosis and autonomic dysfunction. B, beta. Okay, let's see. Lock it, please. Oh, yes. Very well done. And this time I could see Babar Azam doing his thing. He was playing it sensibly. And I think he has put it in the right slot for a 6. Well done. Very well done. 5 sixes in a row. Can you repeat a second hat trick of 6s? Let's see, because you have question number 8 on your screen. So do we have HMC back? No, they are not back. So I'll do the honors. The question is, which of the following is a risk factor for sudden cardiac death in diabetics? A, mild hyperglycemia. Option B, hypocalcemia. Option C, prolonged QT interval. Option D, decreased LDL levels. Option E, hypokalemia. Start now, timer, 60 seconds.
ये तो सेम है वो।
नहीं देखें
बी और सी सोम है।
हाइपोकलीमिया जो है वो तो डायबिटिक्स को होता ही नहीं ना, क्योंकि उनमें ऑलरेडी इंसुलिन डेफिशिएंसी, इनको तो हाइपरकलीमिया होता है।
हाँ।
ठीक है, तो बाकी रहा हाइपोकैलेसीमिया।
hypocalcemia and prolonged same है
प्रोलॉन्ग QT इंटरवल हाइपोकैलेसीमिया के साथ
prolonged QT interval hypocalcemia में ही होता
लेकिन डायबिटिक्स के अंदर तो हाइपोकैलेसीमिया की वजह से नहीं हो रही ना, वो तो ऑटोनोमिक न्यूरोपैथी की वजह से।
प्रोलॉन्ग क्यूटी है, सी
Prolonged QT
प्रोलॉन्ग QT टॉर्सेट डी पॉइंट्स सडन कार्डियक मेरा ख्याल है चार।
prolonged QT interval
25 seconds.
चार्ली के साथ
15 seconds, come on.
Charlie
C, Charlie, you want me to lock C, right? Okay, lock C, Charlie. And yes, that is a hat trick.
yes
Very well done. So that's 6 in a row. Very well played indeed. I think this is where the teamwork comes into play, the way they were discussing it, and trust me, we really enjoy it here when you discuss and decipher the code. Very well played, wonderful game. Great going, and we still have 2 more questions. So I think we are going towards a reasonable, a good score, and that's what we were hoping for. So can we have the next question? Question number 9 on the screen, and I'm going to read it for you. Which of the following is most predictive of sudden cardiac death in type 2 diabetes? A, retinopathy. B, low HDL levels. C, resting heart rate of more than 90 beats per minute. D, serum creatinine of more than 2.0 milligrams per deciliter. E, resting heart rate of less than 60 beats per minute. And the timer starts now.
डी क्रेटिनिन
नहीं
सीकेडी पेशेंट में मोस्ट कॉमन है कार्डियक डेथ।
लो
सडन
HDL
कार्डियक डेथ टाइप 2
सीकेडी
में।
पेशेंट में
हाँ नहीं आपकी बात भी ठीक है, लेकिन मेरा ख्याल है अगर रेस्टिंग हार्ट रेट ही 60 है, इसका मतलब QT प्रोलॉन्ग है उसका। अल्टीमेटली बात तो फिर वही होगी जो पीछे होती रही। एक पेशेंट ब्रेडी कार्डिक है। हाँ अगर 60 से कम हार्ट रेट है तो ये प्रिडिक्शन है वो कभी भी ब्लॉक में जा सकता है।
हाँ
सही कह रहे हैं।
रेडी रिदम हो सकता है
रेडी अरिथमिया हो सकता है।
रेडी रिदम हो सकता है
60 तो
बाकी क्रेटिनिन तो रेस्टिंग हार्ट रेट ब्रेडी 60 बीट्स पर।
Okay, so 20 seconds, come on.
ई करते हैं
15.
E
Which one? E
E.
epsilon?
E
Okay, or
Yes.
E epsilon. Heart rate less than
yes
60.
yes
Okay, and this one is the wrong answer. So the streak has been lost. Oh, after 6 wonderful answers, we finally got one wrong. And I think you still, you played it well, but never mind. You still have the last question of the innings. And it is going to be a good total if you can hit the mark this time. All right, with this we move to the last question, question number 10 rather. All right, I'm going to read it for you. Among diabetic patients, the presence of which condition most significantly increases mortality risk from arrhythmias? Option A, peripheral neuropathy. B, nephropathy. Option C, autonomic neuropathy. Option D, retinopathy. E is gastroparesis. Timer starts now. Is it a full toss? Is it going for a 6?
मैं चार्ली के साथ
मोर्टालिटी
चार्ली
चार्ली लगता है।
हाँ हार्ट मैं प्रोसेस वही है, वो तो कोई इन्वॉल्व नहीं है। पेरिफेरल न्यूरोपैथी का कोई काम ही नहीं है हार्ट के साथ, नेफ्रोपैथी का कोई काम नहीं है। तो सारे
चार्ली के साथ चल
जान है साहब
साइड में रहती है।
रन इट
चार्ली कंफर्म। Charlie.
Okay, are you sure about it? You want me to lock C, Charlie, right? Are you sure?
Yes.
I think this was a spinning delivery. They seem to be a bit unsure. This is the last delivery of the match, in fact, of this innings. Let's see how significant the answer is. They are saying C, Charlie. All right, lock C, Charlie. And yes, you got this right. It's gone for a 6, a huge one over long on. Very well done. So I think they've closed the innings, the first innings, with a good hit, a good stroke, and a wonderful answer. Very well done. So now,
Total out of
what we have is a total. All right, hold on, teams, hold on. Mics, yes, hold on with your mics. I think we've got a total of 42 in this first innings. And with this, I think I'm going to move towards our experts, and I'll take their views. First of all, the umpire, Professor Aziz Saab, he's got a smile on his face. Sir.
Thank you very much. I think I enjoyed this inning, and I must admit the scenario was slightly unusual. Maybe you can call it slightly difficult, but they did quite well. And I must compliment their mentor, Dr. Harun Bilal, and we know each other very well, and we go together in King Edward, and then we are also together at PSIM. So the team did very well despite the difficult scenario.
Right, so thank you very much, sir. I think your comments are always extremely important. And do we have any of the panel experts yet on board? I think we don't have. And on the other hand, we were having some technical issues with the HMC rivals team. So I believe they are back. Are they back? All right, HMC rivals, are you back? Can you hear us? We do have some internet issues at the moment. They also had some electricity issues at their end, and they had to come up with an alternate. I think the team is on it. So can you hear us? HMC? G. Okay, so I think can they hear us with the audio at least? Okay, so technical team, please look into it. I think even if we can have the audio, we can still work it out. HMC, can you see me? Can you talk to me?
Yes. Yes.
No, it's good to have you back. Okay, good to have you back. Yes. So the scenario is,
Thank you.
your DGK seekers, they have put up a score of 42. Are you aware of that?
How many did they get right?
A score of 42 with 7 correct answers out of 10.
No, have they completed the all?
Yes, they have completed. They have completed. because I was reading the questions in the interest of time, and they have answered 7 out of 10 with a score of 42. Okay? So you have to correctly answer 8 questions out of 10. Are you with me on this? You have to answer 8 questions correctly. All right. So that's all set. The team is ready. So can we have the second scenario on the screen, please? And I will request seekers to read the scenario, please.
57-year-old man.
Scenario is not clear for us.
Okay, they'll make it clear. Technical team, can they see it? So I think you'll have to pin it. Pin the screen, please.
Should I read it?
Hold on.
Just a second.
It's blurred.
Okay, hold on. We are holding on. Don't worry. We are holding on.
Now it's okay. Now it's fine. Now it's fine.
Okay, start reading, please. Read the question,
A
seekers.
57-year-old man was brought to the ER. According to his colleague, he had been complaining of severe muscle weakness, lightheadedness, nausea, and 30 minutes. According to the family, he is real estate officer and he has been known case of hypertension for the last 15 years. He was prescribed lisinopril 20 mg once daily. He was compliant with the treatment and his BP readings had been within the normal range. However, over the past few weeks, he experienced a stressful event at work. He had been unable to sleep properly, suffered frequent episodes of headache, for which he self-medicated with NSAID and doubled the dose of antihypertensive medication without monitoring his BP. On examination, he appeared middle-aged male of average height and build, oriented but partially responsive to command. Pulse 80 per minute, BP 130 by 80, RR 30, afebrile, SATs 98 on room, sugar level 116. CNS, chest, precordial and abdominal examination were unremarkable. ECG showing sinus rhythm with tall T waves.
All right, so HMC rivals, I will give you a few seconds to gather yourself. It's an exhausting Vinay, I know. Let me know when you're ready.
Yes, we are ready.
So they are ready. Can we have the first question on the screen and read it, please, seekers?
What is most important investigation you would like to diagnose this case? Serum electrolyte, D-echo and EABGs.
Okay, 60 seconds on your screen, please.
Yes, go with A. Alpha.
Okay, so you have come down the wicket. You've taken it on the bounce. You want me to lock A? Alpha?
Yes.
Okay, they are sure.
Yes.
Lock A alpha. And yes, that's the first 6 on the first delivery. Very well done. That's a great start. So you definitely need 7 more of those and you'll be through. Let's see how it goes. Can we have the second question on the screen, please? Read it. Seekers, are you there?
Lock E.
Oh, hold on. Seekers, are you there? I think we have lost seekers, so I'm going to...
In this case, insulin.
Okay.
Yes. Yes.
Okay, so I'll read the question number 2 myself. So it
What
said...
is the first line of treatment in this case?
Read the options.
What is the first line of treatment in this case? Alpha, insulin, beta, sodium bicarb, C, atropine, delta,
supposed to read it.
albuterol, nebulization, and E. calcium gluconate.
Yeah, you have 60 seconds on your screen now. Please answer.
Lock option E.
They're very sure. They were already down the wicket before the ball was delivered. That's confidence for you. So which one should I lock? E? What should I lock? Have we lost them? I can't hear them.
E.
Lock option E.
Okay, they want us to lock option E.
Option
alpha.
E.
E epsilon, calcium gluconate, lock it. And yes, very well done. Nicely played. And that's another 6. Very well done. So we do have some technical internet issues. Hearing each other out is becoming a bit difficult. So but I think both the teams are doing a wonderful job. And, the technical team is also doing their best in this current scenario. With this, we move to question number 3. Read the question, please.
You told your junior that they should avoid all of the following drugs in this patient except A. spironolactone, B. furosemide, C. eplerenone, D. beta blocker, and E. amiloride.
60 seconds on your screen. Okay, HMC rivals, are they there? They should be unmuted. The rest should be muted.
B.
Okay, HMC rivals, are you there? Seekers, please mute yourselves.
Yes, option B. B. Mark B.
Okay, we can only hear them. So
Option B.
HMC, option B. B for beta, furosemide, or D? Okay, we can't hear them clearly. We'll wait for them, I think.
Option B.
B, beta? Beta?
Yes. Yes.
They want us to lock B.
B.
Furosemide? Furosemide?
Option B. Option B. Yes.
Okay, furosemide. Option B, beta. Furosemide.
Yes.
Lock.
Yes.
Lock, please. Yes.
Yes.
Okay.
Yes.
Well done. There's a lot of repetition and echo here. We can't hear you clearly. I think the technical team is on it. But with all this technical issue, I think you're on course. You're giving the right answers. And that's your 3rd correct answer in a row. Very well done. Rivals, great job. Okay. Question number 4 on your screen. Read it. Seekers, can you read it?
If the same patient presented to you with lightheadedness, fatigue, a pulse of 65, and echo showed a PR interval of 220.
Just a minute.
Just a second.
Just a minute. Please share the screen.
Okay. So hold on. I think I'll read the question once you have it. They are also having technical difficulty in reading it. I will read it myself. Can you see the screen? Rivals? You have to pin the screen, rivals. Can you hear us? Okay, so I'm going to read the question for everyone. Everyone else should be muted. Question 4 is, if the same patient presented to you with lightheadedness, fatigue, a pulse of 55 per minute, and ECG showed a PR interval of 220 milliseconds, what should be the initial treatment of choice? Option A, insulin. Option B, sodium bicarbonate. Option C. Atropine. Option D. Albuterol nebulization. And option E. Calcium gluconate. So the timer starts now, 60 seconds. Rivals, are you there? I think there is some definite technical connectivity issue. So maybe we can have them on the phone. I think the team is working on that. Meantime, we have 25 seconds to go. Ten seconds to go.
Option E. Option E. Option E.
Option E. Yes, so suddenly we hear E, epsilon, calcium gluconate, right? And that's the wrong answer. Oh my God. That is the first mistake you've made. E was the wrong answer. The right answer was C, atropine. All right. Never mind. You still have margins. You can still do it. Both the teams are fighting it out. Can we have...
Yes, but it was disconnecting a lot of time and we haven't even got.
Okay, so we did hear E, but that was the wrong answer. So can we have the HMC team on the screen? Can we have them there? Okay, so technical team. Okay, so they are disconnected, and we do have the other team which is sitting over there, and I can see them clearly, the seekers. And I think we'll just hold on for a moment. And we do have them on the screen now. HMC rivals. Can you hear me?
Yes, please. Proceed with the next question, please.
Okay, so we are going to move to the next question now. So far, 3 correct answers and 1 wrong answer. Question number 5 is on your screen. Seekers, can you read it?
All
Okay,
of
so
the
please.
following are indicated for permanent pacemakers in the patient described in question 4 except option A, asymptomatic Mobis type 1, option B, asymptomatic Mobis type 2, option C, symptomatic first degree block, D, asymptomatic bifascicular block, and E, asymptomatic fascicular block.
60 seconds on your screen. So that's a bouncer. Let's see how they play it.
Symptomatic first degree blood हम ना को pacemaker. Symptomatic first degree.
ये symptomatic Mobitz के ना को
Mobitz type 2 दे. Mobitz type 1.
If the patient
Mobitz type 1 is type 2 second degree.
I'll request you to discuss it in Urdu so that everybody can understand, or English.
symptomatic B की हमको symptomatic है type 1 की C की देखा ना C की patient is symptomatic
Urdu or English, please, for discussion. 25 seconds.
Symptomatic first degree blood लिखा नहीं हुआ कि symptomatic है या asymptomatic है वो सारा रखते हैं
C कम
15 seconds. Come on.
go with A.
You want to go with A alpha, right? A?
Yes.
Okay,
Yes.
lock A alpha, please. Well done. You got this right. The discussion is extremely important. HMC rivals, listen to me. Discussions are extremely important. I think that's when you get to the right answer. But you know, English or Urdu, because we want to hear you, and everyone will not be able to understand any other language, you know. So well done. In the spirit of the game. In the spirit of the game, I think we are all here and we are all going to do it the way it is supposed to be done, and very well played. Very well done. I really like the camaraderie that you guys have, and great going. Both the teams are pretty good. They're fighting it out, and with some wonderful questions. All right, I'm sure Aziz Saab is enjoying, like always. And we have question number 6 on your screen. Read it, please.
If this patient presented to you with lightheadedness, palpitation, and pulse of 120, BP 90/60, and ECG showing wide and bizarre QRS complex that are identical to what would be the first line of treatment? Option A, injection amiodarone. Option B, lidocaine. C,
The patient is
CPR and
unstable.
unsynchronized cardioversion. D, CPR and
Drugs to
synchronized
I will
cardioversion. D,
give
E,
CPR
synchronized cardioversion.
Start it,
with
please. 60 seconds.
synchronization modus
I guess this is a ventricular tachycardia, monomorphic,
unsynchronized, yes.
unsynchronized is C.
Patient is unstable. Patient unstable
When there is identical, why should not we go with synchronized?
because synchronized pulseless to come electrical activity the pike bako. If for example sign is sticky the patient they are
Are you sure full treatment? That's why you
patients
25 seconds.
Nice, yeah, synchronized. Pulse está. Yes, sir.
D go with D.
You want to lock D? Delta? Okay. So the flighted delivery was there. It was a loopy delivery, a spinning delivery. Let's see where it goes. Lock D Delta. Oh no! It was a googly. Went the other way. Oh, the discussion was brilliant. I think you were discussing all the aspects very rightly. But in the end, you got the wrong answer. And I know it's getting to the wire. It's getting to the wire already. The margins now are negligible. All right, best of luck to both the teams. So we still have 4 questions to go. Let's see where it goes. Can we have question number 7 on the screen, please? Read the question.
Your junior doctor were confused about initiating treatment after reviewing the ECG. Which of the following favors a ventricular origin over a supraventricular origin for the arrhythmia? Option A, AV dissociation. Option B, QRS interval less than 140 millisecond. C, fusion beats. D, left axis deviation. And E, QS complex in V6.
And the timer starts now, 60 seconds.
AV dissociation.
He can be ventricular tachycardia, AV dissociation he can go.
No options. Fusion beats की कम तातर ventricular rhythm रहते हैं.
كداشي هو فيوجن بيتس ده كان زمان بخيال با كان سوبرا فنتريكولار اريثميا زي كنا لك بايكن كداشي تكشو كان سيدا او كيفارس كومبلكس
There is
ليس
a
ذان
calling for ventricular origin. Origin की AV dissociation
ايفي دوسيشن فور ايفي بلوك كده فنتريكولار فيبريليشن كده كل بي فك كي فيوجن بلوكس كي
They are
ليفت
saying ventricular origin.
Approaching 20 seconds now.
ايفي دوسيشن فور مالتيبل سيزون كداشي
15 seconds.
go with A alpha.
Okay, so you want to go with option A, alpha.
Yes.
I hope you know that you
Yes.
had 4 questions. You had to answer all 4 questions to get through. You answer 3 of them, then it's a draw. And then maybe we'll have to improvise and we'll see. So, with this, it's an important answer. Question number 7. And they have asked me to lock A alpha. Lock it, please. Oh, my goodness. We have brought it down to the wire, and I think it's only going to get more interesting. Right, I know the seekers are excited. They know they are in the game. And if you give all 3 correct answers from here on, it's a draw. And then we'll get to another stage, which is going to be 2 questions apiece. All right, let's get to question number 8.
Regarding long-term treatment of VT in this patient with an expected survival of more than 1 year, all of the following statements are true except option A, ICD is best for significant LV dysfunction with VT. B, beta blocker is the best for structured heart disease with VT. C, catheter ablation is the best for ischemic cardiomyopathy with VT. D, amiodarone lower mortality in VT. And E, amiodarone reduce the frequency of ICD shocks in VT.
And the timer starts now, 60 seconds.
2 was a long-term mortality. With an expected survival of more than 1 out of the following statements are true. मतलब ये Madron
mortality VT.
mortality VT के निश्ता
No Pashto, please. Urdu or English. Come on, guys.
The best for ischemic cardiomyopathy with VTs.
I think there is this origin of one area of origin of VT.
20 seconds. Come on.
Madron lowers the mortality in VTs. Madron reduces the frequency of RCD.
Approaching 10 seconds. Come on.
Shocks in the VT.
Come on. 5 seconds. Which one? Hurry.
D. Option D.
Oh, just at the last moment. I think I'll have to ask the umpire. Sir, are you there?
We have answered it at 7 seconds were left, but you have received, I think so, it at 2 seconds.
Okay, I think you were still within the time. Do we have?
Yeah, they were within the time actually.
Okay, thank you very much, sir. Thank you. Yes. So I've been told by the technical time as well. All right. So you want me to lock D, right? D delta. Okay. Can we?
Yes.
Okay, lock D delta. Yes! You are still in the game. You are still in the game. I can see the excitement. Every delivery, every question is important. Okay, all smiles. And you know one thing I figured out about you guys, you can only think in Pashto. That's when you're thinking. So you know your language is figured out by the language which comes in your dream. I think this is your dream language, this is your language. So but still you're trying hard. Well done. All
If
right.
I may interrupt, I think at the scoreboard there's slight confusion. I think one of the zeros is shown in black. It should be shown in red. And DJK team.
Yes, sir, you're very right and rightly pointed out. Yes, for the seekers, I think the zero should be in red. It's the third zero. Yes, the second question. It's been corrected. Thank you, sir. Always the eagle eye is there of Professor Aziz Saab. Thank you very much, sir. Okay, 2 more questions. Extremely important. We are all holding our breaths. Question number 9 on your screen. Read it.
The patient underwent coronary angiography. We showed no obstruction in the coronary vessels. Among imaging techniques, which is the strongest predictor of recurrent VT, VF in this patient? Option A, coronary calcium scoring. B, coronary calcium scoring. C, cardiac MRI. D, PET scan. E, SPECT scan.
60 seconds on your screen.
A and B are same. So
A and B are the same options.
Yes, I think you're right. It's these two are the same options.
Strongest predictor of recurrent
VT, VF in this patient. Either करूँगा किसी मत में cardiac MRI
SPECT scan by
cardiac MRI or SPECT scan. Cardiac
spectrum scanning, PET scan को खैर नहीं है.
Okay, I want to correct this option B. Listen to me clearly. The option B is myocardial perfusion scan. All right? So you still have, I think we'll give you time for this. Yes.
The question I sent, it is clearly written myocardial perfusion scan. I don't know why this mistake happened, but it is clearly myocardial perfusion scan. Option number B is
Right, sir. So should we give them more time, sir? 10 or 15 seconds? How much?
Okay, no harm in doing that.
Okay. So give them at least 15 more seconds. Come on.
इसके में दो VT VF की नहीं करना.
इसकी में नहीं था obstruction नहीं था.
Okay. So do you have the answer? Come on. Last few seconds. 7, 6. Come on. Answer.
Vote for C. Option C.
Okay,
Option C.
C, Charlie. Okay, so I think we heard it clearly. They want me to lock C, Charlie. Lock it, please. Oh, yes. Well done. You know, it's really getting tough. The conditions are getting tougher. Hurdles after hurdles. And both the teams, they are not letting go. Very well done. You know, trust me, my friend Qurban would have loved this game as an electrophysiologist, because, you know, I, being an interventional cardiologist, I'm loving it. Every bit of it. Wonderful. Great display of knowledge and diligence. Well done. Okay, with this, we now come to the last question of the second innings of the match. If you answer this one correctly, then we will move to the next stage, because we'll have 42 apiece. If you answer this incorrectly, then we know that the seekers are going to win. So this is the last delivery, extremely important for both the teams. As tough as it can get, as close as it can get. With this, I request you to bring the last question on the screen, please. Read the question.
As this patient survived cardiac arrest, which of the following statement regarding survival of cardiac arrest is false? Alpha, post-MI cardiac arrest require urgent coronary revascularization. B, post-MI cardiac arrest require prophylactic ICD. C, targeted temperature control improves prognosis. D, post-MI cardiac arrest can be managed with wearable cardioverters. And E, EF less than 35% required permanent ICD.
60 seconds on your screen.
Requires urgent coronary requires prophylactic
ICD, targeted temperature control, improve prognosis. Post-MI cardiac arrest can be managed with variable converter. EF less than 35 permanent ICD. Is false. Post-MI cardiac arrest can be managed with variable cardioverter. I think so. That is post-MI cardiac arrest.
30 seconds.
ICD.
prophylactic.
No, prophylactic. No.
B, option B.
All right. Which option?
B.
B, beta.
Yes.
So this is post-MI cardiac arrest requires prophylactic ICD. Is that so?
Yes.
B, beta. Okay, so now everyone just hold on for a minute and focus and concentrate. So this is the last ball, the last delivery. It's really getting very tight. And they have gone for option B, beta. Let's see what happens. Okay, lock B, beta. Oh, yes! Wonderful play. I think that's what we all were hoping for. And this is as wonderful, as exciting as it can get. Aziz Saab, are you there?
Yes, I am.
I'm sure you must be enjoying. Sir.
Yes, I am. And now let's go to the second part. I think one question each team. We have some two surplus questions.
Very right, sir. So we know the format, 2 questions apiece, and whosoever scores more is going to win. Are you ready, both the teams? So who's coming first?
Let's ask one question each team, and whoever drops first will lose.
Right, we can do that. So who wants to go first? Or should we select randomly, sir?
Sorry?
Let's ask the first team the first question.
Okay.
DG Khan.
All right, so we have it from the umpire. DG Khan, are you ready for the question?
Yes.
They are ready for their first question. And after this, we'll go to the second team, which is the rivals. Okay, and I will request HMC rivals to read the question. So can we have the question there? The technical team will let us know. So it's on the screen.
It's not displayed yet.
Okay, it's on the screen. You'll have to pin it. Technical team, help them. Do you see it?
Can I read it?
Yes, please read it.
In diabetes, which of the following ECG findings correlates most with increased risk of sudden cardiac death? Left axis deviation, QTC prolongation, right bundle branch block, first degree AV block, right axis deviation.
And the timer starts now. Seekers, unmute yourself. We want to hear you discussing. Can we have seekers on the screen? I can't see them. Thirty seconds to go.
Beta.
Okay. Are you sure about it?
Yes, hopefully.
So they are
inshallah.
very sure. They are trying to swing it away. And I see this one was an inducker. They've gone over mid-wicket. Let's see. So you want me to lock which option? Say it again.
Beta. B.
B, beta, QTC prolongation. Lock it, please. And yes, that's a 6. You got it right. Well done. Very well done indeed. So we are going to take a couple of seconds. We'll get the cue from the technical team for the other question from the other team. HMC rivals, are you ready?
Yes.
Okay, we'll have the question soon on the screen. We are ready with the question. Can we have it on the screen? Read it, please.
If this patient presented with 6-hour history of the chest pain and was diagnosed with uncomplicated STEMI, you started IV alteplase after completion. Repeated ECG shows regular broad QRS complex with rate of 80 beats per minute. What is your diagnosis? A. Torsady point. B. Post MIV fib. C. Outflow tract VT. And D. Fascicular VT. And E. Accelerated idioventricular rhythm.
60 seconds on your screen.
Ventricular भी बस जानते हो accelerated
30 seconds, but we can't see the answering team. Yes, HMC. Can we have them on the screen, please? Yes. Approaching 20 seconds now. 15 seconds.
Go with E.
Are you sure about it? You want me to lock E epsilon?
Yes.
Okay, they seem to be sure. They want me to lock it. Is this a ramp shot for a 6? Let's find out. Lock E epsilon. Oh yes, it was definitely the ramp shot. A tried Yorker, very well negotiated, and this one has gone for a 6. Very well done. Okay, we have to get to the second question now. We are still standing with scores leveled. All right, what a match. What a match. Okay, so, Seekers, are you ready?
Yes.
So we'll have the question soon, and we have the question. Rivals, read the question, please.
Why is hypoglycemia considered a risk factor for arrhythmias and sudden death in diabetics? It causes coronary thrombosis. It induces parasympathetic overactivity. It causes catecholamine surge and QT prolongation. It directly damages cardiac muscles. It blocks the sinus wave.
60 seconds, start now.
क्योंकि ये हाइपोग्लाइसीमिया करते हैं उससे स्कैटोकोलामिन सर्ज होता है और प्यूटी चार्ली सी करती है।
It's really getting interesting now.
Charlie, C.
Oh, you seem to be pretty confident. Are you sure? You want me to lock it?
Lock it.
Okay, so it's a good length delivery. He's square cutting it for a 6. Let's see he misses or he hits. So lock C, Charlie. Lock it. And yes, he got it right. That's a 6 for sure. Well done, well done. You guys are playing it so well. Okay, now with this we have the second question of the sudden death, which is going to be asked. And if this is a draw, I've been told, then it's a draw. Both teams probably will have a chance. This is what I've been told. And can we have the next question on the screen? So read the question, please.
All of the following are used to treat chronic hyperkalemia in the patient except hemodialysis, B. furosemide, C. sodium polystyrene, sodium bicarb, D. and E. Petiramir.
Timer starts now, 60 seconds. HMC rivals, and can we have them on the screen?
sodium polystyrene workout sodium bicarbonate workout पता है कि है bicarbonate
30 seconds to go. It looks like a slower one to me. Let's see what happens. 20 seconds. 15 seconds. 10 seconds. Come on. 7. Hurry up.
D. Option D.
D delta. D delta.
Yes.
Okay. So they want me to lock option D delta. How sure are you about this one, by the way?
Sure. We have done it by excluding other option, and to us, it's the only option which we think we cannot do in hyperkalemia for.
Okay, so let's see what happens to this slow delivery. D delta, lock it. And yes, you got this right. Very well played. I think both the teams have done so well. And again, we had a score of 42 apiece. Then we went into the sudden death, 2 questions apiece. And wonderful. It's 6s all around. Correct answers all around. With all the troubles we've had with the connectivity, we simply had no trouble here with the answers and the teams and the performance that they came up with. So I'll quickly move to our umpire, our senior faculty member. He's the life of this show for sure, I think. Aziz Saab, sir.
It was really very, very exciting and a nail-biting match, and I'm glad both of them performed very well, and I'm not sure what is going to be the solution. Both teams, of course, go ahead to the next level, and I congratulate both of them. They really played very well, and I enjoyed every ball and every delivery. Thank you.
Very
and
right.
You did very well. You always perform very, very well. You look like a very professional, I think, commentator.
Thank you very much, sir. I mean, it's this excitement from everyone and the faculty members, which actually keeps me going. With all the work that we do, I think this is the most exciting part for each and every one of us. And I'm so happy today that we've had this outcome. Very rarely do we come across such matches and such performances where we have draws and when both the teams are not letting go. And I think we do not have any of the faculty members today with us. So, but still, we now know that in the end we had DDK Seekers and HMC Rivals, and they played brilliantly well. It was a draw, and even in the sudden death, we came up with a draw. This goes to show that if you strive hard, I think you can always have winners, and there are scenarios when you truly have true winners on both the sides of the game. And I think this was something that was showcased today. It was an honor being here, and with this I'm going to thank our worthy umpire of the game, Professor Azizur Rahman Saab. He's always there to guide us and support us. What a keen eye he's got. And we've got the two teams, and I think the two teams are extremely excited. So best of luck to you, both the teams, for the next upcoming games, and for the rest of the tournament as well. And I think with this we have come to the end today, and I'm now going to sign off. Till next time. So it's Allah Hafiz from my end.